was afraid I had got a sore on my penis, so I guess it sort of cured itself or something, just like the flu.
The really bad thing about clap is if you let it go, it'll turn into syph.
Me tell some investigator who I've been making it with? What do you think I am?
No kidding. I really did get it off a toilet seat.
I'm Dr. Joshua Siegel. I diagnose venereal disease at the Los Angeles County Health Department. Right now, VD has reached epidemic proportions. Unfortunately, venereal disease, mostly syphilis and gonorrhea, affect our young people. I think that it's about time that we got some proper information in reference to this particular disease. Too many people, mostly our young people, are kept away from our clinics because they do not know the proper reason behind our venereal disease problem.
The really bad thing about the clap is if you let it go, it'll turn into syph.
Some people think that syphilis and gonorrhea are the same disease. It is not true. They are only transmitted the same way through sexual activity. This is the gonococcus, the bacteria that transmits gonorrhea, which produces a purulent discharge in the male. It's passed from person to person across the warm, moist, intact mucous membranes of the genitals, mouth, and rectum. This is the spirochete which transmits syphilis. It gains entrance through intact mucous membranes, also through the skin. Also, it gains entrance congenitally across the placenta to the fetus.
No kidding. I really did get it off a toilet seat.
You cannot get VD from a toilet seat. VD is only gotten primarily through sexual activity, sexual intercourse.
Luann, do you want to tell me why you're here today?
Well, my boyfriend's been coming into the clinic, and they think that he might have gonorrhea.
If this intimate sexual contact makes you even suspect that you may have syphilis or gonorrhea, it's important that you get help as fast as you can. Every state has local or state public health clinics, and some have volunteer-free clinics too. The people who work in them see a lot more VD cases than most private physicians, so they are experts in what they're doing. And they're here to help you get rid of a disease, not to humiliate you or judge you or reprimand you. Everything is strictly confidential. You've had some burning on urination, right?
Yeah.
And discharge. This patient has all the classical symptoms of gonorrhea. A burning sensation while urinating, and now a thick, yellowish pus-like discharge from the penis, which has a characteristic foul odor, very simple to detect. These symptoms usually occur from 1 to 3 to 5 to 9 days after contact with an infected sex partner. Now, to confirm the diagnosis, we do a culture and a gram stain smear the discharge. If the lab finds gonococci, the diagnosis is positive. Treatment? We'll have you go back to the investigator and name your contact.
I don't have the clap. I mean, if I did, I'd have some kind of drip or something like the guys.
If women have symptoms, and they usually don't, they're similar to the ones that men have. Frequency of urination, a foul-smelling vaginal discharge, sometimes lower abdominal pain, and inflammation of the genital area. But, unfortunately, in women, it's more typical for a woman to have gonorrhea and have no symptoms at all. Lab tests are the only sure way to tell whether a woman has gonorrhea or not.
I can't give VD. I'm on the pill.
Birth control pills are not a preventative medication for gonorrhea. As a matter of fact, a woman on the birth control pills runs a 100% chance of being infected with gonorrhea if she has sex activity with an infected male. The reason for that is the chemicals in the medication change the pH of the vagina to a point where the gonorrhea lives much more favorably in that area, see? But you do have gonorrhea based on your lab results, and we're going to treat you. The medication is called vibromycin. It's taking 2 capsules now, and you'll be taking 1 capsule every 12 hours starting at 9 o'clock tonight. And it's a shame that not enough people come in for treatment because it's such a simple disease to treat. All it takes is these capsules and you're treated. Okay? Simple, isn't it?
What the hell? The clap's no worse than a bad cold.
In men, untreated gonorrhea spreads to the prostate gland, the seminal vesicles, and the epididymis. At first, they become inflamed and painful. Then abscesses can form in them, which may drain through the urethra, or maybe have to drain surgically. The scar tissue which forms when these abscesses heal can block the urethra, producing extreme pain. The result is not only a serious urinary problem, but sterility in males as well as in females. In some cases, it may even lead to arthritis. Just as it does in women, untreated gonorrhea is more often a problem for a woman simply because she doesn't have any symptoms in the early stages. Nevertheless, it spreads across the mucous membranes of the vagina, the cervix, and into the uterus. Once it gets this far, this patient will experience tremendous amounts of pain, and it spreads quite rapidly into the fallopian tubes and into the ovaries. Again, abscesses form, drain, and scar over, producing sterility. This means that the ova can't pass through them into the uterus for pregnancy. No matter how quickly a woman is treated at this stage, damage to the tubes is inevitable and usually can't be corrected without major surgery. Since the gonococcus can't cross the placenta, a baby is safe while it's still inside the mother's womb. But if the mother has gonorrhea and she delivers, the child's eyes can become infected as it leaves the uterus and passes through the vagina. Fortunately, there are state laws which state that a child born must have counteractive drops, which are usually silver nitrate or penicillin, whether the mother is infected or not. Unfortunately, you can pass on the effects and consequences of syphilis much more easily from a mother to a baby. There are no drops to cure syphilis in the delivery room, as we do have in gonorrhea. Children born with congenital syphilis will have to live with their handicaps all their lives. You have a suspicious-looking sore on your cervix.
Oh, wow. Are you sure?
I'm sure you have a suspicious-looking sore. But you can be rest assured that if you do have syphilis and the dark field comes back positive, you'll get adequately treated.
How can I have syphilis? I don't have any symptoms. I don't have any discharge. I don't have any discomfort. It's ridiculous.
It's quite true, many times, sure. It's the male that sees it, and many times the male misses it. Now just think how lucky you are that somebody named you to come in. The first symptom of syphilis looks like it should hurt, but unfortunately it doesn't. It's called a chancre, and it's an open sore, which emerges at the place where the spirochetes entered the flesh.
I was afraid I had syph when I got a sore on my penis, but it went away, so I guess it sort of cured itself or something, just like the flu.
The unfortunate thing is that even without treatment, the chancre heals up in a few weeks. The victim looks as good as new, and he thinks it's over. But that's not true. The spirochetes are now multiplying and moving through the bloodstream to the lymph nodes and will present a secondary syphilis eventually. But the untreated victim who got rid of his primary chancre thinks he's cleared up until he enters the second stage. And even then he thinks he's cleared up because the rash that presents itself is something he's never seen before, and eventually that also goes away. We can get it cured in ample time, so don't worry about it, okay? Just a matter of a couple shots now and a couple shots next week, and you'll be all cleared up. Any questions? No. Okay, why don't you go to the next room, we'll start some treatment. Okay. Now next week you'll get 2 more injections, and then you'll be all cured up, see? But what gets me is, you've had this rash for 18 days. Why didn't you come in earlier?
I just thought it was an allergic reaction to something I ate or something.
You ever been allergic before?
No.
Okay. Didn't you notice a sore before this?
Yes, but it went away.
A lot of people have symptoms that they don't think is syphilis, and syphilis resembles a lot of other diseases. Best way to find out if you have syphilis is by a blood test. We have patients who've been to private doctors who don't diagnose syphilis because they're unfamiliar with it. So laboratory evidence is very important in syphilis, and you do have a high titer, so this is definitely secondary syphilis. The devastating thing about this disease is that 35% of the people who develop syphilis and who remain untreated, within 20 to 25 years later, they come down with late syphilis, late complicated syphilis. Late complicated syphilis can invade the heart, the central nervous system, and also certain organs of the body. This is the most devastating. This is a picture of an aortic aneurysm. This is killing.
Syphilis. Oh, God, that scares me, that word.
Shouldn't be scared of that word. It's not a dirty word. It's not a dirty disease, and you're not a dirty person because you got it. Doesn't mean you're bad. You're lucky that somebody named you as a contact so you could come in here and get treatment. The treatment will be these injections of penicillin and 2 more injections next week. Then you'll be all cured. You won't ever get the disease again unless you become reinfected. And you can help yourself not become reinfected by naming all the contacts that you've had when you're interviewed by the contact investigators, who are very nice people, and it's all confidential.
Me tell some investigator who I've been making it with? What do you think I am?
Now it comes down to finding out exactly who these people were. Now, what was your last contact and who?
Well, it was last week.
Last week?
Mm-hmm.
Now, remember, we are interviewing for the last 3 months since you were diagnosed as primary.
Mm-hmm.
Last week, what time?
Oh, Saturday.
Saturday of last week, being July or August 8th. Is that about right? August 8th?
Mm-hmm.
And the young man's name?
John.
John who?
Conley.
Was John a pickup type?
No.
Someone
He's
you
an
know?
old friend.
He's
yes.
an old friend. Okay. What's John's phone number?
I don't know.
Do you know where he lives?
It's in the phone book.
In the phone book.
To help in the control of VD, contact investigators interview patients to locate their contacts. They go out into the field. Some people are belligerent, embarrassed, disbelieving. However, many are cooperative and anxious to receive treatment. The dimensions of the problem are such that even great success in finding contacts is a drop in the bucket. The only real hope lies in preventing venereal disease.
What would you do for prevention?
Well, I heard that you wash very well and urinate.
That's for
That's
gonorrhea.
basically, yeah,
That's for gonorrhea.
that's basically what I would do.
How about a condom?
Would you like to know a 100% way of preventing gonorrhea?
I think everybody would.
Okay.
It's the use of a prophylactic or condom.
What can a girl do to prevent? Yeah.
What can a girl do?
Uh-huh.
I'd like to make a suggestion here. Certainly at any given time of any particular love set, right, there will be an opportunity for you to observe your partner. Suggest taking a shower together, right? I say, come on, hon, let's go take a shower. At this time, you got the lights on. You can view her body, right? So, okay, if she appears to be clean, or if you notice something that's rather unusual, you can get sick all of a sudden.
You're going to have, especially women, you're going to have somebody put something into you that's going to be dangerous. I looked at it first. A male has a worse time than a female because the male can't see the sore of syphilis.
Yeah, I was going to just say that.
The prophylactic for syphilis treatment, the prophylaxis against getting syphilis, obviously, is with the male. The beauty of this disease, it's treatable.
Uh-huh.
And the more important beauty of this disease is it's preventable. In other words, if you know who your contacts are, and you come down with this disease, see, we can get those people into treatment before they even get the disease. We can stop it from happening. It was never done that way before, but we do it now.
It's pretty embarrassing to have to blab on somebody.
Not blabbing. You're showing true love for that person.
But couldn't you just call them up yourself and say, here's what happened, instead of giving their number to...
Starting a chain reaction. If the person is like, if a male is naming a woman, and he says he's going to tell her, she won't have any symptoms. If you weren't feeling sick, would you go to a doctor?
Doctor, what about the business of somebody who's underage and doesn't want his parents to know about it? Do you report it automatically to the parents?
No, that's the law. It was just recently enacted, I think, two years ago, Jerry? 2, 3 years? Where a minor under 21, under 18, can go into the clinic and just sign his own release. And his parents are not necessarily notified. He doesn't have to tell his parents that he was at the clinic. And he's treated. He's treated as an adult.
What do you think is the best way for you personally to prevent VD? What would you do?
Well, if I was very promiscuous, I'd probably use a prophylactic or abstain as much as possible.
Yeah, you're not going to abstain. What would you do?
Use a prophylactic.
Okay, what about you, Janice?
Well, I wouldn't use a prophylactic.
But you could assist the partner.
Certainly.
No, that's protection for you too.
That's
not
right.
just for him. Aside from that, what do you think is a good idea for you as a woman?
I'd be checked. I'd go to a doctor.
John, what about you?
Well, what I would do is I would wash well and urinate after. You know, I think that, and use a prophylactic or something.
Okay. Angie, what about you?
I was wondering, because I take the pill, and I go into my doctor very often to get a checkup, does the checkup include checking if you have VD?
I would have to say
just
no.
assume-
No, the average doctor does not administer a voluntary VDRL unless
you ask for it.
Unless you ask for it. It's a separate test altogether.
I do want to ask, does anyone have any idea where syphilis started from?
Yeah, I wanted to ask that.
So what came first, the chicken or the egg?
No, it's a toss-up.
It's too academic, really. It's too far back. It's here and it's going to be here, but we can eradicate it. We can do prevention.
No kidding.